Do you feel like you've hit a wall in your psychotherapy and you're not quite sure what to do? Or maybe you feel like you're just spinning in your own story over and over and over again, and you're getting tired of bringing up the same old points and learning more and more of the same about yourself in your therapeutic process. Or maybe your therapist has released you from therapy and you just know there's got to be something else. There's got to be some way to go deeper and to be that's more encompassing of your entire being. I know this firsthand because I've been here myself, and in this video I'm going to talk some about my own personal story about how I became a transpersonal psychologist, and also I'm going to talk about what you can do when you feel like you've hit a wall in psychotherapy. I'm Dr. Meg Haworth. I'm a doctor of transpersonal psychology. I'm a holistic nutritional chef, and I help women, especially women who've been through abusive and neglectful and difficult childhoods, usually people that are very successful but feel like they hit a wall and they want to go deeper, and maybe they've gone through some regular psychotherapy for some time and now you just feel like there's got to be something more. And so that's where I take my clients to, because it's what happened for me. So when I was 15, I took my very first psych class. I was in high school and I loved it. I was hooked. I knew then that I wanted to be a psychologist. And so by the time I got into college, I was very excited. But what happened was, in my first year of college, as a psych major, of course, I just kept hearing the same theorists over and over and over again. It was like 4 different men, and once in a while a woman would be mentioned, and I just felt like we're hearing these same theories, but there's got to be more, and I don't know how to articulate what this is. I just knew that I needed to switch majors, so I went to social work. And social work was also not really where I wanted to be. And so I ended up getting a degree in English with a concentration in writing. And one of the main reasons I loved English so much is I already was naturally a good writer and I enjoyed it. But I also loved English because we would be able to study character and we'd be able to talk about the layers of stories and all the different subtle things that were going on psychologically, mentally, emotionally, physically, spiritually, all of the different aspects of these characters. And so that was really fascinating and wonderful for me. And so I dropped it for a while. Meanwhile, I'm in therapy. So because I was sexually, physically, emotionally abused as a child, I drowned, which also I had a number of different post-traumatic stress issues from the drowning, including some night terrors where I would wake up gasping for air regularly. So there were a lot of layers of things going on with me. And so psychotherapy, traditional psychotherapy, was wonderful. It did wonders for me, and I'm so glad that I did it. But 15 years of doing a certain type of therapy is a long time. I would go and try different therapists, and I would go through the therapy with them, and they would release me from therapy because I did so well. I just kept craving something else, and I just didn't even know how to articulate it until I found transpersonal psychology. And right before I found it, I had this one therapist who was spiritual. And she started to ask me questions about my intuition, and started to give me just some basic exercises to use with my intuition. And I didn't quite understand how highly intuitive that I was. I mean, if you follow me, you may have already heard me say, that I used to know things about people without them telling me anything as a kid. I used to see spirits as a child. I had all of these different extrasensory perception abilities, but I really didn't know what to do with all of that. And I didn't know there was a way to fuse all of that. And I was able to fuse it all when I found transpersonal psychology, because I was looking for somebody to try to help me understand why I would have those extrasensory experiences and what I could do about it. And then to combine that with psychology and motivation and what makes people do what they do, people's emotional patterns and all of that, without it being about pathology and treatment of disorders. In other words, in transpersonal psychology, if you were to come to me, I wouldn't be looking through the DSM-5 to see, well, what psychological disorder does this person have? Because I don't diagnose and treat disorders like that. I'm very informed on that because I'm fascinated by it. So I'm always reading books and articles and watching documentaries and all kinds of things about mental health. And I use that as another layer of understanding, because I think that as humans, we're actually pretty complex. But so I looked at transpersonal psychology because of the way it fused the mental, emotional, physical, and the energetic and spiritual, so that I could put all of those things together, because we're one unit. Each one of us is a holistic system, or has a holistic system, and we're all one unit. And so when I found this, I went through the therapeutic process so quickly. Like it's like it sent that process into lightning speed. I was struck by lightning, so the word lightning, when it comes out of my mouth, I have to laugh a little because I'm still here. Yay! There's actually a video on my channel about my story if you want to learn some about that. But yeah, so this is why I went into transpersonal psychology, is I felt like I was getting so much all at once, and I was feeling such significant differences in my own body after having had over a dozen illnesses, finding out I had food allergies, removing the allergens, getting significantly better, but having a horrible time still with anxiety and depression. It was just mind-numbing. I also had a suicidal ideation. I would just, certain things and certain people in my life would trigger me into just wanting to end my life. Which now I kind of understand was me wanting to really end my life. It's wanting to end the pain I was in, because the pain was so excruciatingly difficult and significant. It would almost paralyze me. So I'm happy to report that I don't have bouts like that anymore. I do have sometimes where I go through depression. It's usually situational because something difficult is happening in my life. Or I might feel a little bit depressed, and I'll know what to do to help me unhinge it. And that's part of one of the many gifts that transpersonal psychology has given to me over the years. And so, so I was going to tell you what you can do about it. So say you are highly intuitive, you've had extrasensory experiences, maybe you've seen things that other people didn't see, you've known things that they didn't know, you're highly empathetic, you may get drained in the presence of some other people in your life, you're highly sensitive. All of those things are indicators that you may be a really good candidate for something like transpersonal psychology, where you feel like you want to go deeper into yourself, and deeper into your emotional patterns, and helping you to release those from your energy system. And that's a big part of what I focus on, is helping you release from your energy system, which is connected to your body. The two are one thing. And so I often will say, I often say to my clients and my students in my practice that as long as you're in a body, the fun never stops. There's always something that you can be working on. But when you go into transpersonal therapies, you do energy work, you do Reiki, you do spiritual psychotherapy, which is a big part of what I do, and holistic therapies, and that would include using food to support your body to heal itself. Then you go into this whole other level of healing and wellness and getting well. It's just the most incredible thing, and I'm such an advocate for this world because it worked so well for me. And then I have had the great pleasure of watching thousands of people who've been following me over the years, reading my books, coming to my talks, listening to me online summits, on my podcast series, on other podcasts that I'm a guest on. I've had this incredible career really helping people through this. And then one-on-one clients, I still work one-on-one with my clients. To me, it's my laboratory. It's where I learn the most. And grow the most as a therapist and as an author, and someone who can really help you I focus a lot on the connection between adverse childhood experiences and how that's affected your physical body over time. It's healing illness with food and the power of the mind and heart. I created a technique called whole person integration technique that helps you to release the core negative beliefs that you might be holding in your body, and also the energy, the emotional energy that you're holding in your body from past experiences, because it's one of the things we do is we kind of stuff that down. I also do an inner child therapy that is incredibly amazing. I mean, it just did so much for me, and I had to get certified in it and help other people with that as well. I worked with anyone, anywhere, all over the world. As long as we have the technology to be able to communicate, we can do it. I also teach my students in my course, Evolving Intuition, Building Self-Trust for Life, how to develop their own intuitive abilities into a skill, how to heal empathic overload, and how to use whole person integration technique on themselves and also on their own clients. So I coaches, therapists, healers, conscious health practitioners that want to expand their practice with a new modality that can really help their clients heal and release blocks, and help you release the blocks through your intuitive insight, because nothing gums up your intuition more than emotional patterns, from fear, shame, guilt, sorrow, all of these things that sort of get clogged in our systems, and it helps you to release that or unclog the system. I often think of it as deleting an old app that isn't working anymore, an old emotional app of patterns of yours, and installing a new emotional patterning app for you so that you can get well and feel better and more and healed. So I'm happy to report that the fibromyalgia, chronic fatigue syndrome, autoimmune issues I had, all of those things are in remission by the way that I live my life, and the way that I think, and the way that I feel on a daily basis, and the way that my perception has shifted dramatically over the years. And that's what I help my clients do, is shift their perception dramatically from who they think they are to who they know they are. There is a gap, and I walk people along that gap to get to who you really are, so you can live your highest purpose, your path, your meaning. Anyway, if any of this resonates with you, I hope it does. Please just book a free call with me. I do free consultations with people anywhere in the world who just want to talk about anything in this video. Or if you feel like, hey, intuitively, you're just like, I just need to work with this person, I feel like she's really going to help me, then just book a free call and we'll see if we're a good fit for each other. If we're not, I have a huge network of people, so a great practitioners all over that may be able to help you, and I can connect you with them. So just let me know what you think. You can also put anything in the comments below, any questions you may have, any comments you may have, any experiences that you may have had with your own healing and therapy. Maybe you hit a wall and you found something that really worked for you. I want to know. I love to expand my horizons and learn more from your experience as well. I think it's really powerful to share each other's stories. So thank you so much for listening. I hope this information has been helpful to you, and I hope it will help you get well now.